Rising cases of COVID-19 and the threat of the new variant in the country. Let's get an update on testing efforts from Testing Czar Vince Dizon, who joins us now from Clark, Pampanga. Secretary Dizon, thank you so much for joining us. We're now seeing this holiday surge, in the infection numbers. Are you ramping up testing of PCR tests?
Yes, Rico, our testing continues to be at a level that we are comfortable with. But as you said, with the new variant being discovered in some areas in the country, particularly Bontoc province, in the next couple of days, we will be ramping up tremendously the testing in that town. Our swabbers and our teams from the Department of Health are already in the area. They came from Isabela and Cagayan, and they're already headed towards Bontoc in order to start the aggressive community testing there starting tomorrow. So what we're trying to do now is we're trying to make sure that we are able to trace the contacts of those that have already tested positive, both for the new variant and also for the regular COVID-19 strain.
So, Secretary,
with the goal of being able to test as many as we can in the next couple of days.
So, Secretary Dizon, by how many percent and by how much are you ramping up the testing this week compared to the previous weeks?
Right now, we're testing roughly about 30,000 per day. We want to bring that up to above 40,000 in the next couple of days as we ramp up testing, not only in Bontoc, but in other areas as well. And as has already been announced by the IATF, all arriving Filipinos from abroad will now need to be tested twice. The first time upon arrival, and then another test after 5 days. So we are hoping to ramp this up in the next couple of weeks, going up to maybe about 45,000 tests per day in the coming days and weeks.
So, Secretary Dizon, what is the protocol for the first testing and the 5th day of testing for those arriving in the country? If they're negative on the first test and then they're negative on the 5th day, can they be released, or do they still have to continue until the 14th day of quarantine?
No, right now, they will be in strict facility quarantine upon their arrival. If they test negative both on the first test and on the test after 5 days, then they will be allowed to do home quarantine and return to their respective local government units. But Rico, all these protocols are in constant review by our experts in the Department of Health and in the private sector, our private sector medical experts. So we are just trying to cope with the new things that we are learning on a day-to-day basis from the new variant, trying to learn from what countries are doing, and then in ensuring that we have the proper safeguards here to control the spread of COVID-19 within country. And I think the numbers, while they have increased in the past couple of days, we're still not at a level that we saw in the middle of last year when our levels were reaching above 5,000 cases per day.
All right.
We're still at 1,500, 2,000 new cases per day level.
So, Secretary, the RT-PCR has always been the gold standard, but now the Department of Health has already introduced saliva testing. Will saliva testing also be used widely? Will it also be used in the airports and for mass testing?
Just to correct that, Rico, just to make it very clear to our viewers, saliva testing is also an RT-PCR test. The only difference in the saliva test is the method of collecting the specimen. Unlike the normal RT-PCR test that we've gotten used to in the past couple of months, which collects the sample via a nasal swab and an oral swab, this is as you see in the pictures and in the video being shown, you collect the specimen through saliva. no,
Correct.
from the saliva of the person. This not only makes it easier for the person who is getting tested, it is less invasive. You don't have to endure a probe or a testing stick up your nose or into your throat. Now you just have to spit the right way into a collection tube, no, as you
So,
see in the video.
Secretary, with the saliva test, how soon will you be able to get the result? And then the second question to follow up on that is it cheaper than the PCR test?
Yes. So the saliva test, the saliva collection test, actually is number one, a lot cheaper. Now, according to Senator Gordon, and we want to congratulate the Philippine Red Cross because they are the first laboratory to be accredited to do this type of testing in their laboratories. And they were the ones that started this way back in September of last year. The cost will be reduced to about 2,000 or even lower later on when the tests become more accessible to more people. So that in itself is already way lower than the current 3,000, 3,500 PCR tests. Second, I think according to the experts from the University of Illinois, it is also faster, which means people can get their results quicker. According to the Red Cross, the results can come out in less than 24 hours.
Okay. By February, mid or end of February, the vaccination program of the government will begin, and of course, the LGUs. There are suggestions, Secretary Dizon, that a person needs to get tested first before he or she can get vaccinated. Is this a serious option?
Right now, there is no requirement for you to get tested before you get vaccinated. Because the purpose of the vaccine is really to provide you with the necessary inoculation against COVID-19. Either inoculation against getting the disease itself or inoculation against severe disease, meaning you even if you get COVID-19, you will not get these severe symptoms which will require you to go into the hospital and eat up on our very limited hospital capacity. So, but of course, we will have to rely on what our experts say on who should be vaccinated with what type of vaccine. And then obviously the kind of dosing that is necessary. As you know, various vaccines have different doses. Most of them are double dose, but there is one, the Janssen Johnson & Johnson vaccine, which based on the information we have will only require one dose. So we will have to rely on our vaccine expert panel to show us on how to properly administer the vaccines and who should get what vaccine.
All right, thank you so much for that updated information, Secretary Vince Dizon, the country's testing czar.